Let me start the meeting. Yeah, let's start the meeting. All right. 7:01. Call to order, 7:01. Number 2 is approval of the October 14th meeting minutes. Board, did you get a chance to look at the meeting minutes from October 14th? Do you have any changes that you'd like to add to it?
I thought it was okay.
It was good. It was okay.
If there aren't any changes, I'll make a motion that we approve the minutes from October 14th. Is there a second?
I'll second too.
All in favor?
Approve the minutes.
Aye.
Great. Okay, moving on to number 3, citizen speak. Do we have anyone for citizen speak? No, seeing no one. I'll move to number 4, 5-9 Thatcher Street. Discussion of violations, correction order, and updates. So I do have an update for you, board, and I sent it to you this afternoon. I reached out to Mr. Richard Joyce from Newman and Newman, and he said the owners have recently paid for and obtained a certified plot plan, which was provided to the architect last week. The architect expects that he will have an application to the planning board within the next 3 weeks. And then Mr. Joyce also attached 2 inspection reports from the city service exterminators. And he did send pictures that they did put some bait boxes, a number of bait boxes in and around the site at 5-9 Thatcher Street. So I just wanted to give you an update.
I just have another question with that. Part of the other thing that we asked them to do is make sure it was boarded up for those areas that were maybe open and fencing. Do we have any confirmation on that?
Yeah, he sent the pictures that he sent, and before the last board meeting, he did put plywood up all around all the windows up to the stairways. He secured the fence, so it was all boarded up.
Okay, thank you.
And then Caroline, quick question.
Mary.
Do you know the cycle that they're on for checking those bait boxes?
Well, he sent me October's and November's, so they went each month. So it's maybe monthly from what I'm seeing. Yeah.
Okay.
Anything else? Take your hand down here, Mary. Any other questions? No? If not, I'll move on. To number 5, approval of the health department FY27 budget. Now, if you had a chance to take a look at the budget, we were asked to provide a level budget this year, and it's a little bit, let me grab it, a little bit higher than last year because of steps and lanes, and we have to go up on the steps and lanes, so it went up a little bit. I think I did add one more person going to the MHOA conference because we all went this year, and I'm not sure if they'll. We have like NC8 was able to help Carolyn go this year, but I'm not sure if they'll be able to do that next year. So I put that in there. So last year, FY26 was $454,066, and for FY27 with the steps is $458,079. But other than that, it remained the same. What we did change, there is one thing that we did change with the department budget this year, is, and I spoke to Roxanne about this and briefly to Laura. So I wrote a memo to Nick Milano about this. We're going to reduce Schedule E professional services. So $8,000 that we previously paid for Paul Brogna's services. If you remember, we changed the regulations around to have the homeowners take full responsibility of how much the plans cost to be reviewed. And so that frees up that $8,000 that we previously paid Paul Brogna in Seacoast Engineering, and move that to have a per diem nurse that'll work maybe 3 to 4 hours a week. So if you just take a look at the memo that I sent to Nick, and what that nurse will do for that 3 to 4 hours a week, what they're doing is, it's called Foundational Public Health Services, and it's a model that's the national model actually, but the state is adopting it, and it's providing public health services that should be available in all communities. And one of the public health services is maternal, child, and family health, which promotes supporting new parents and newborns by providing services and access to care and improve health and healthy outcomes. So this nurse, who's going to be working 3 to 4 hours a week, would be making visits to new parents, and really it's more access to care too, and identifying if the mom or the family needs any kind of services, or maybe the mom might be depressed postnatal after having a baby, and like postpartum depression, and getting the services to the new moms and the new families if it's needed. So this is actually a program. It's in the North Shore right now. There's a number of towns that are running this, and they want to bring it to the South Shore. So we're doing some trainings around that. And actually, Sue was at a training today about how to take babies' blood pressures. So it's being offered by nurse consultants, and these nurse consultants are in the state. So this is coming from the state. They want the foundational public health services to reflect maternal and child health also. So it's new trainings that are being offered, and we're encouraged to go. And this person that will take over as a per diem nurse, public health nurse, will be going out into the community and assessing the needs of new babies and moms. So, does anybody got any questions about that?
Nope.
I have a quick question, Caroline, on the budget.
Sure.
The revolving fund. So can
Mhm.
you speak a little bit about what we have as a revolving fund and how it is and so forth?
So that's on page 2. Let me just go through this here for a minute. So if you go like midway down, it's 2650. It's on page 2. It's a revolving fund. Okay, so we take in primarily money from our seasonal food clinics, and that goes to pay for the vaccines, and also pays for the needles and the shots container program that we have. Right now we have $72,626 in there. With the revolving fund that keeps on year after year, we don't lose money. It just keeps on accumulating. We can spend up to, I believe it's $40,000 a year. But we have to actually, we have $72,000 in there, but we pay for, as I said, the vaccines, any kind of programs. We have the needle exchange program we pay for through the revolving fund, and we can pay out up to $40,000 for like the syringes and all the supplies for all the vaccines and stuff. The revolving fund.
Okay, thank you.
I
Yeah,
think
go ahead.
this year too, with revolving fund, I asked Nick, because Sue works only 16 hours a week. At some times she was very, 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 very busy with the camps, and she was very busy around the flu season. And he said she could use the revolving fund monies for maybe up to 2 to 3 hours. 19 was the most you could use, because if it hits 20, we'd have to provide benefits. But there were some weeks that Sue did put in for an extra 3 hours out of the revolving fund, and he allowed that to happen.
I think that's great. Thank you.
Mhm. Does anybody else have any questions with the budget? We have our general expenses. They remained the same. As I said, a little bit more on the training and education. Where we spend the most money is training and education and dues and memberships. So that's where most of the money is going, because we have to keep up with all those state regulations and all the changes that can happen. We also had, I had 2 warrant committee members come to my office on Friday, actually, Julia Maxwell and Cecile Yang. And we met for about an hour. So they're from the warrant committee, and they wanted to know about the budget and where we're spending our money. And they had a lot of questions, but I explained everything to them and said to them if they need to reach out again, they can call me or email me. So. And then also with the budgets, I included the budget narrative, which really breaks it down, very well of where we're spending our money. And also all of our accomplishments was in there too. I think I have it here, but they asked for like accomplishments from 25, FY 26, and then predictions out to FY 31. So we listed all our accomplishments too. Anybody have any questions? Here it is, my list of accomplishments. It's quite extensive. If you want to add anything to it, you look at it and say you'd like to add some kind of something else you'd like us to be doing, please let me know. Or goals and things. And I'm still waiting, so it's not the final budget, because I'm still waiting for one quote from our Permanite system. So, and I know why I wasn't able to get it. It's because they are being sold off to another company. So I sent an email, I didn't get a response, and I sent another email, and I still haven't got a response. So I'm sure I'll send another email this week to ask how much the cost is. It was $9,800 last year for Permanize. And Permanize is our permitting system for everything that we have, and the building department uses the same platform. So we're able to look in when we have to do like demolition policies or things that's going on in the building department. We can go right into Permanize and look at that too. So that's all our permitting system. So I'm just waiting for that last quote. So it's not a final, so you don't have to vote on it tonight. I can bring it up at the next board meeting too and say, and if you got any questions or whatnot, please email me and let me know. And we'll get the final when I get that last bit of information about that quote. Anything else, anybody? About the budget?
Caroline, quick question on Anne. How is she doing meeting with people? I know she's had issues with space.
She's doing well. She's able to go downstairs into the Baker room to meet clients. Yep, so she's still doing that. And she's able to secure the space online and secure the room. So she's going up and down.
Okay, good.
To meet the clients, yep. Move on to number 6. Discussion of opioid abatement funds and small grant opportunities. I know I've given you this paperwork previously in another packet. What you could do is look at it again, and if you have any questions about the amounts of funding or any more grant opportunities that you want to put on here or take off of here, you can let me know individually, and I can change it and bring it up at the next board meeting, if you'd like me to do that.
I think
So
that sounds good.
This is just a small grant request.
Give us a chance to look at it.
Okay. Yep.
Do you have any updates, Caroline, of any other things that aren't on these lists that other places are doing? Just out of curiosity, are there any updates? I know for a while you had some like seminars that you were listening in on and things like that. Has anything else happened since that original time?
No other seminars have occurred. They changed hands from Care Mass to another. Do you remember what it is, Emily? It's another company. But I did file the annual municipal expenditure report. So every year, and you have that in your packet. Every year we have to submit all of our reporting of what we've spent and available funds. So I can let you know about that, the opioid money. So the total funds available right now is $406,459. And then it has to say like the carryover fund was $335,763. It says how much was dispersed. They have you fill out exactly what we've spent the money on. So we spent the money on the Riverside recovery coaches. We spent the money on our consultant, November Sky, Bryce Cole, to do the assessment. The Health Resources in Action, we did a Narcan training. We've spent money on supplies and stuff for the opioid stakeholder and focus group interviews, and spent money on the Milton Times, and lastly on food for those programs. So they actually want you to put down every penny of what you spent the money on. And this was all new again this year because they're trying to figure it out. But this is new accounting that I have to do and new paperwork. But we did spend a total of $25,346.48 this past year of the opioid abatement monies.
And what about two other things, I guess? One would be, what about the money for like the Narcans that are in town hall and things like that?
So we've gotten Narcan from Manic Community Health Center, and they've dropped off a bag of Narcan for us, and we put it in the front hallway in town hall, and we've only had a couple of people, I would say like 3 or 4 people, take the Narcan. So very small amount of people have taken the Narcan. We could also, purchase it when that runs out with the opioid abatement funds money. But, man, it was did give us a big bag of Narcan and directions on how to use it too. So we have that in the health department, which is really good.
And I'm just wondering, with where it is in town hall, I guess we assume people know how to use it, but are there any directions, like pictorial kind of directions if someone needed it, for instance?
Yep.
Because I'm thinking if people don't all speak, English or understand and read, well, if there are the pictures of what to do.
I'm trying to think what's in that plastic bag that it's in, Emily. Do you remember if there's pictures in there? It's a little plastic bag. It has, directions, but I'm not sure if it's pictures. I'd have to look at it again.
I think there's pictures beside the directions. Not super detailed, but at least showing like the motion of putting the nasal spray in. So.
Okay. Thank you.
And we're still waiting, talk about that. We're on that thread. We're still waiting. For the $20,000 grants that we put out. No one has applied. No one has sent us anything so far. That the date is the ending date is November 30th. So we're waiting for any applications for that $20,000 And the schools know about it. So,
Yeah, and it looks like you're also waiting for that final MOU for the
Yep.
Sheriff County one. I don't know if you want to talk about that.
yeah, I'm still waiting for that. So town council looked at that and they made a number of changes, and I've sent that back to the Norfolk County DA's office, and they have to send it back to me to finalize it. So you're right.
Okay, thank you.
Still waiting on that.
Caroline, I have just a quick, I was kind of continuing to look at the opioid abatement funds, the grant requests.
Yes.
I'm thinking under grandparents, I'm wondering grandparents probably could utilize some therapeutic supports in like some support groups. So if you want to kind of
I can put that in there.
pencil that in, we could expand on that possibly,
Mhm.
talk more about it.
That's a great idea, Mary.
Yeah, the grandparents have it tough, don't they?
Mm.
I'll note that. Anything else? Oh, yeah. Looking at it. Nothing else? All right, if you can look at that between now and our next board meeting, and please reach out to me if you want to add anything, or if you want to change the funding available, or if you like the numbers that are written. That'd be great. I'll reach out to you. That's it.
Okay.
Oh, dokes. And then a couple of things, health director's report. Just a couple of things I want to touch on. 58 Smith Road, I sent an email and I called them. I'm still waiting for an answer of what's their next step. So they did complete the asbestos work inside the building. And I left a message for the Temple Salem Adventist Church. And I also left a message for the last, his name is Rahad. He was working as like a overseeing the project. And I'm waiting to hear. I sent him an email too to find out like what's our next steps here. I think they did mention that they'd be starting in the spring, but I'd like to get a timeline on that, like I got with 5-9 Thatcher. So I'll reach out again. I'll continue to reach out to find out what their next steps are at 68 Smith Road. And then 333 Thatcher Street is another. We sent another house that we've sent correction orders to, and town council is going to take that up because the person has not done any corrections to the house, and town council is aware. So I'll keep you updated on that. So it's in town council's court now. Let's see what else. 333. My staff went out to another house today. It was 141 Pleasant Street, and they actually went out with Tara Brettel. Tara's been out to this house before, the Housing Renewal Division. There was a number of violations there previously in 2022. We brought it to their attention then, and we're working on it again now. I think at that time they were behind on their taxes and stuff, and they got everything up to what it should have been. And then my staff is working on another correction order for that, and then Tara Brettel may move ahead with maybe appointing a receiver or maybe condemning. But according to town council, when I spoke to town council, they said let's go with Tara Brettel at the it's the renewal. Yep, so they said to do that first instead of bringing it to town council. What used to be called the what was my thread of thought here? The Abandoned Housing Initiative, but now it's the neighborhood renewal. So she's going to take that up and let's see where that goes. And then drug take back, that was successful on October 25th at the police station. Ann and I were there. We did the food drive this past Saturday from 9 to 12. And we had about 30 people that dropped off some food, and they dropped off like a number of bags each. So we had quite a bit of food, and that food will be for the emergency bags that Ann hands out, and also for the take one, leave one shelves. And it gives a variety of what you can put in the bag. So we had some extra food, and we were able to store it at the fire station. So Chris Madden allowed us to do that. So I thought that was good for the first time we've ever done something like that. And then I nominated Mary McCole and Elaine Rico Moore for the Thanks for Giving volunteer of the year for the health department. Mary and Elaine, they came to our we had International Overdose Awareness Day, and also the Lives Remembered, Hope Renewed library event. You were there, Roxanne, at the library. And they shared their stories of their sons who passed away. And I thought it was very brave of them to share their stories. And it reduces the stigma of addiction. We could only nominate 2 people for that. So I did nominate Mary and Elaine for that. And the event is going to be November 23rd. Is it? It's going to be at the Parkway Methodist Church, I believe. I think it's November 23rd. I can get it to you.
Yeah, it says November 23rd in the packet, so.
There we go. So it says in the packet. Okay. I got a lot of information here in front of me. All right. What else? Yeah, it says 4 to 5:30, Parkway Methodist Church, November 23rd. And then the healthcare capacity audit. We sent the letters out. Emily sent all those letters out. I haven't heard from anybody about that, but just wanted to let you know about that.
That's up on our website too.
Yep. I'm going to put that up there.
And then what about the flu clinics? Do you want to give us an update on that?
We ran the townwide, 2 townwide clinics, employee clinic, one at the Home Inc., Pierce Clinic. And I thought we had a better turnout than last year. We still have some leftover vaccine. I'll let you know how much is left. I know Sue is still giving vaccine in the office to people, but we did get a better response than last year for our clinics, which is good.
Well, yeah, I was just going to say, if you still have some left, you might want to put a little thing in the Times or something, and even out on the maybe the cable, right? And just say, if you still need a flu shot, and then maybe you could get a few that way too.
Yep.
Just an idea. I mean, because they've been talking more about it lately, but it's interesting. They're talking about that new strain that's over in like Europe or wherever. And they talked a little bit about how this may not actually be a good match, which is typical. But they do say that it might, at least help a little bit. But
okay.
But it doesn't seem like it's a match. So
I didn't hear that yet.
Yeah, but that hasn't come over here yet, from what I've heard. But
there's somebody in the waiting room. Who's this? I don't know.
I think we're almost done, aren't we?
I know. I just saw it now. Did you see? I just saw that person now.
Carolyn, it's me. I'm switching devices.
I'm hearing some reverberation here. Yep.
Switching devices.
Okay,
Okay.
okay. Can you hear us now, Mary?
I can, thank you.
A little bit of
Echo.
echo, yeah.
It looks
My
like we're
sense is
looking at
that.
a future
Okay.
meeting date, right?
Future meeting, anybody have any more things they want to bring up? Emily? Anything? A lot of information.
Do you have anything that you anticipate coming up in the next month?
I don't know, we don't have any septic right now that's in the queues. I don't think so. If you want to push it into January.
I was thinking if there isn't, we probably should, because if you run it out a couple of weeks, you're really running into like Christmas and New Year's weeks.
Yeah,
Unless there's something that comes up. I mean, it sounds like we probably could wait till January.
yeah.
I don't know what other people think.
January is
me.
probably good. Yeah, January. Good.
All right, well, let's take a look at January then, and see what we think.
January 5th
preferences?
or the 12th.
That's not holiday, right? That's not usually the 19th, I think, is the holiday, right?
19th is the holiday, yeah.
19th is the holiday.
Yeah. So 12th, is that what we're thinking?
12th is good for me.
Yeah, that works for me.
All right, so we'll do the same thing on the 12th,
Do
7
you want
o'clock.
to have it, do you want to have it on Zoom or do you want to have it in person? I know Laura had mentioned in person too.
Yeah, I'd like it in person if we could.
What do you think?
Do you want to get back to me or?
Yeah, I mean, I don't mind going in person. I just don't know how January is going to be in terms of weather.
Oh, that's true too.
Oh,
You know,
true.
because it's January. I mean, if we're talking
Yeah.
March, that's different, you know.
Put it
Maybe
on the
put-
agenda for January. Talk about it in January.
Okay.
Okay.
Do you want to do that, Laura?
Yeah, sure.
Because I don't mind coming in person. I just don't know how the weather's going to be in January. It's an
Right.
icky month. So
true.
maybe we can talk about it then and see
Okay.
for the
Yeah, let's
spring.
do it on Zoom and then we can talk about it.
All right, that sounds great.
Yep. All right, great.
And if it looks like it's going to be great weather, then we can maybe switch it, to
Yeah.
in person.
Yeah.
Yeah, that sounds good.
All right.
All
I
right,
think
sounds
that's it,
good.
right?
Yep. So it's 7:34. Would you vote to adjourn?
I'll make a motion that we adjourn.
Second. Second.
All in favor?
Aye.
Aye.
Okay.
All right.
Thank you.
All
Have a
right,
nice
thank you.
Thanksgiving, everybody.
Okay,
Thanks,
you
everybody.
too.
Good night.
Thank you.
Thanks. Bye.
Bye-bye.
Bye.